our space, healthcare, is getting really, really, really crowded. And the players are not all just doctors and nurses. They're businessmen, they're entrepreneurs, they're scientists, they're engineers of all kinds. And some of our brightest and best are being recruited by the Apples and the Googles and the Amazons of this world. These companies are driven by data and analytics, and they see healthcare as being ripe for disruption. And part of the reason for that is we, the established stakeholders, the providers, the payers, and the policymakers, we've been a bit slow and a bit resistant to being disrupted. Our top-down, hierarchical, paternalistic system is being disrupted. It's broken, it's worn out, and it should soon be taken off life support. So the trend in all of this is also very clear. We're seeing a pivot to innovation centering on the patient, who is a more active and involved decision maker in their own health. So with the innovation happening, thanks to the smartphone, devices, and wearables, we as healthcare providers can be of enormous value to our patients, but not in doing the things that they can do for themselves. So if convenience and comfort is not enough reason to change, surely the capacity issues that we're plagued with right now must be. So non-face-to-face medicine, virtual care, telemedicine, call it what you will, it's here to stay. And our patients are going to increasingly demand it because they are enabled with cameras and sensors and detectors connected to their phones or other devices, and it means that we can actually move closer and closer towards true continuous care as opposed to this old visit-to-visit episodic care. So the move is clear. We're going to move from volume to value, from inputs to measuring outputs, and we're going to go from face-to-face to virtual. Most experts now think that Watson or perhaps Google's DeepMind or something like that will become the best diagnostician in the world. To take that further, many contend that a child born today will rarely need to see a physician to make a diagnosis by the time that they're an adult. The whole principle of disruptive innovation says that if I keep doing what I did to get me here successfully, it will ultimately lead to my demise. So I have to unlearn and adapt to the changing world. And I would contend this is why the CMA of tomorrow should not be the CMA of our fathers. We can either plod along with manila folders, fax machines, and telephone systems that put us on hold, or we can grab the uncertainty that comes with the new technologies with boldness and get turned on.